you talked, Jason, about one of the things that we talk about a lot, me being in healthcare and a pharmacist, is about type 2 diabetes. And there are a lot of people on medications to treat type 2 diabetes. I, as a pharmacist, my wife is a pharmacist, we absolutely do not believe in medications to treat type 2 diabetes. But there are some people in healthcare out there that I debate with that says diabetes is not reversible. Let's go.
Well, yeah. So what's super interesting about that you go right there is, I can't speak as a physician or a medical professional, but I can speak with what I see on a week-to-week and day-to-day basis. And I would say, from a wellness coaching perspective and a lifestyle medicine perspective, type 2 diabetes is the poster child ailment for reversibility and prevention through lifestyle. It's the most, all of the other common lifestyle ailments respond very well to lifestyle improvements, but type 2 diabetes, in my experience, responds the most thoroughly and the most quickly.
Yeah, I agree with you. It is the one that is the most linked to lifestyle. And if you change your habits, it's the one that's probably reversed the easiest, the quickest. One thing one challenge that I have ongoing, and I always tell people, if they're on medications that will, cause hypoglycemia, don't do this. But if you think diabetes isn't reversible, I just dare you to fast for 24 to 48 hours and tell me that your blood sugar doesn't go down. And I mean, that's just a rational question. And the answer is, and anybody that knows anything will say, well, of course your blood sugar will go down. Bingo, right?
Well, I think that's what makes type 2 diabetes interesting from a lifestyle medicine perspective and wellness coaching perspective, is because it's so responsive physiologically. It's an incredible bridge to the sense of empowerment that one ultimately gets when they make lifestyle improvements. What I mean by that is, a person has this strong epiphany relatively quickly. Obviously they don't get all the way they want to go overnight, but relatively quickly they get to see and even say to themselves, maybe even out loud say to themselves, I did that. The way I lived today, whether it was fasting, whether it was some other form of improving eating habits, whether it was getting some more sleep. I even see people seeing their blood sugar responding to reducing their stress levels, which is amazing, because that's so much, it's easy for that to be less tangible and seemingly less potent. But when people can see that the way they live impacts their blood sugar levels almost immediately, they start to enter a different game of being less feeling dependent on medication, less dependent on anything outside of them in general, the medical system in general. And this is going to be a weird paradox or ironic term. It's a gateway drug into, wow, I have a lot of ability to control the outcomes of my well-being and even more broadly my life. So I know that was a little bit of a rant, but I think it's very cool for people to see quickly that what they do can influence their blood sugar levels.
Yeah, so tell us, some of the debates I get into also is that, well, some people have type 2 diabetes and they don't need to lose weight. So I don't necessarily, they think, well, that's not reversible then. Can you hit on that? I don't want to put you on the spot, but I bet you have an answer for it.
Yeah, I don't think I have the most thorough answer on this. I'll start by saying that I think sometimes there's a chicken and egg question going on here, and I don't think it's completely well understood. There might be some people on Earth that claim to have this completely well understood. I think the cases can be made, and this is on the edges of my expertise, but I think the case could be made that obesity or excess body fat drives dysfunctional blood sugar dynamics and drives type 2 diabetes. I think the case can also be made that dysfunctional blood sugar dynamics drives type 2 diabetes, and that drives obesity. And I think there's both of those cases can be made. So I think the way I look at this, Shawn, is, and maybe this is an advantage of coming from this from outside of medical training, is I'm less predisposed to looking at things from the diagnosis perspective. And what I simply see is a human, every one of us, has a set of needs in an ongoing sense throughout the course of our lives. And when we meet most of those needs most of the time, we're well. And when we fail to meet a certain portion of those needs a certain portion of the time, we become sick. And that sickness manifests in different ways in different people. And I think some people, they can have type 2 diabetes while being relatively lean. Some people can be have significant excess body fat and not have type 2 diabetes. I think in both cases, the excess body fat and or the type 2 diabetes are indicating that the person is out of harmony with nature, isn't meeting enough of their needs enough of the time. And it almost doesn't matter to me, because the solution in any of those cases is to help that person meet more of their needs, more of their time. And by needs, I mean things like nutritious food, moving our bodies, sleep and rest, relatively low stress, or stated conversely, relatively high fulfillment in work and relationships.